Hello, so today we'll be discussing metaplasia, dysplasia, anaplasia, the difference between them, and also how they're related to words like neoplasia, tumors, malignancy, cancer. So, all these concepts are so basic but so misunderstood, right? So, I hope after this video it becomes crystal clear in your head and sticks forever with you. Okay, so let's start. So first I'll explain each of these terms to you and then we'll come back to the diagram. Okay, so what is metaplasia? Metaplasia is when one normal cell type is replaced by another normal cell type that is better suited to the stress. Okay, for example, in smokers, the normal columnar epithelium changes to normal squamous epithelium. Okay, and this is reversible, but it has an increased risk of cancer if the stress persists. Okay, so when you think of metaplasia, think of adaptive. Okay, now let's come to dysplasia. When you think of dysplasia, think of misbehaving cells. Okay, so cells grow in disorganized, abnormal ways, but they are still differentiated. Okay, so let's say a cuboidal epithelium, if it undergoes metaplasia, it might become columnar or it might become squamous. But in dysplasia, it is still remaining cuboidal, but it's just more disorganized and just looks more abnormal. Okay, now let's come to anaplasia. Anaplasia, one of the most misunderstood words. Okay, so anaplasia, think of loss of identity, loss of differentiation. Okay, these are very abnormal, very primitive looking cells and they have lost their differentiation. Okay, so this is what anaplasia looks like. It does not look like any of the mature cell types, not columnar, not cuboidal, not squamous. It just looks very primitive. So one more point I would like to clear is about the chronology. So I used to think that this is the direction in which cancers go. Okay, like so first metaplasia happens, then dysplasia happens, and then anaplasia happens. But this is not true for all cancers. Of course, some cancers do follow this path, but dysplasia can occur without metaplasia. For example, in carcinoma in situ in the cervix, there is no metaplasia, but there is dysplasia. Okay, and even anaplasia may occur without dysplasia or without metaplasia. So this is not a fixed route that all carcinomas follow, but some do. Okay, so just remember this. These are different terms, these are not different stages of progression towards cancer. Okay, so just remember that point. So on a parallel note, we'll discuss what words like tumor, neoplasia, malignancy, cancer, all of these mean, and in the end I'll link it to the words that we spoke about before. Okay, so understand one thing, tumor is the same as neoplasia. Neoplasia means new growth, right? So that is the same as tumor. Now tumor can be benign or malignant. It does not necessarily have to be malignant. Okay, like when you think of tumor, you don't necessarily have to think of a malignancy. So benign is non-cancerous, malignant is cancerous. Remember these synonyms. Okay, tumor is the same as neoplasia, malignant is the same as cancerous. Okay, not all tumors are cancers. Okay, so now there are two basic requirements for calling any tumor malignant. Okay, so the first one is local invasion. So for epithelial cancer, this means that the basement membrane has been invaded. And the second requirement is distant metastasis. So basically spread of the cancer. If there is local invasion or if there is distant metastasis, you can call it a cancer. Okay, I hope this is clear. Now just remember this one thing, carcinoma in situ is not a true malignancy. Now let's divide cancers or malignant tumors into two parts, well differentiated and poorly differentiated. Now this is exactly where anaplasia comes in picture. Okay, so a poorly differentiated malignant tumor will have anaplastic cells, but malignancy does not always require anaplasia, right? You can also have well differentiated tumors that invade basement membrane or that have local invasion and have distant metastasis, but they are not poorly differentiated. Okay, so this is where we link both these things. So just remember this one very golden statement, anaplasia can exist without malignancy and malignancy can also exist without anaplasia. I'll give you examples. Anaplasia existing without malignancy is carcinoma in situ, right? It's not technically malignancy, but there is still anaplasia. And the second example, malignancy can exist without anaplasia. Cancers like adenocarcinoma and other well differentiated cancers, right? They will have metastasis, but they will not have primitive looking cells or anaplasia. Okay, so that's it. I hope you understood this well, and I really hope this sticks with you forever. Bye.